I had this sent to me from someone in a hospital group. They asked me not to name the hospital group. But this is what they got in their email about staff vaccination. And 49% fully vaccinated, 45% series not started, 6% series not complete. That's a pretty close, I've decided to get the vaccine, I've decided not to get the vaccine, split in half almost for a hospital group. The reason I'm interested in this topic specifically is because oftentimes the coverage around this issue is like you're just anti-science, you're anti-medicine, whatever else, and oversimplifies inaccurately the people who are choosing not to get this. Brandy here is a nurse. She's choosing not to get the vaccine. And not to endorse one way or the other, people need to make their own personal decisions about this. But I'm trying to push back on that narrative that it's just like, I always call it Jim Bob versus the vaccine. The guy that's like the Unabomber out using the outhouse with all his firearms. He's the only person choosing not to get it. That there aren't people with, science and medical backgrounds that are saying, you know what, I want to wait and see. I'm not totally sure about this. I don't want to get it. And I don't want my employer to force it down my throat. What do you think about these numbers, Dr. Malone? And then Brandy, I'd like to hear from your perspective too, as a nurse.
Well, number one, you're looking at a swath of locations that are pretty traditionally Republican conservative. This is down in the Gulf Coast, and it's not surprising to me that there's this ratio. And this is part of the meme that the red states are resistant, and they're resistant. You just gave me the stereotypes, which I personally object to. But I think that what I hear is not much documentation. Is a lot of frontline healthcare workers like Brandy who are seeing vaccine-related adverse events fairly routinely are quite vaccine hesitant, and they're not doing so from a position of being irrational. They have, in many cases, firsthand experience with the, let's say, gently temporal relationships. In other words, relatedness in time between vaccination and a wide range of adverse events that are otherwise fairly rare. So that's a lot of words around. Nurses, frontline ER staff, etc., are the ones that are seeing these folks come in, young people with myocardial events or cerebral vascular events or other coagulopathies, many of whom have sudden onset that is somehow related in time to their having received vaccine. And there's a lot of hesitancy in this primary healthcare provider population because of what they're experiencing. And I think also they're perhaps among the best able to process what the adverse event profiles mean and interpret those in terms of their own personal health. So I'm not surprised by the numbers. I hear many like Brandy that question whether this is the best solution for them.
And I think, Dr. Malone, you brought up a good point about the politicization and how that has shaken out. However, I will say, like Michael Tracy, who's on ROKFIN, everybody should go check him out. Go check out me on ROKFIN, because that's a place. Well, Brandy, she's in and out with her cell phone. Not everybody has the spidey skills of Dr. Malone in Portugal, but anyway, he did a pretty good review of the diversity in different parts of the country related to this, and how there are many voting districts that like went heavy for Biden and have low vaccination rates. And I'll try to find one of those while we're talking, one of those maps. But it does seem like that even is an oversimplification, though. Like, okay, I guess we could say that. Still, these are people who are trained medically, you know, so I still feel like, you know, even with that, it's worth kind of sitting back and saying, all right, well, like what's going on? Why are these people who you know, practice in the medical field so hesitant? Is it all just politics? Could it all just be because they're conservatives? Like I would have a hard
No.
time believing that.
Patients have the right to refuse any care or treatment. Why can't the employees? And that is something that the authoritarian, you have to do what we say or you will not have a job. That's not acceptable. If my patient looks at me and says no, I have to respect that. That is allowable. Why can I not say the same thing? If I have been able to do the research and understand what the risks and what the benefits are, that is informed consent. I have the right to refuse. You think about fear being one thing that's being pushed to lead people, and it's fear keeping people at home. It's fear getting people sicker and sicker because you sit in that stress level and the cortisol's raise, and that opens you up to illness. And so why not keep people in a state of fear and at home and separated? And I know you wanted me to talk on that graph. In my area, our vaccination rate is quite a bit higher. There's about 67% to 70% people fully vaccinated, not with the boosters, but fully vaccinated. And whether it is politically based or not, I think it's also thought based. I'm choosing to speak out because I have talked to a lot of my fellow employees and they feel pushed to do something. And there's this narrative in our society that's pushing for people to go a certain way. And in America, we have the right to choose. You know, we have liberty, we have freedom, we have the ability to ask questions and seek out answers. And if you're questioning anything, seeking out answers and not just believing what's being told to you on the television, talking to other people out there, is do your research, know your rights, know the information. Don't just take what's being presented in front of you, but think about it. And I was watching Doug McKenty's interview with you and critical thinking. We are in a state of, you need to critically think about the information that's coming in front of you. You can't just believe whatever you hear. And that is the beauty of America, is there is so much information available, but you've got to think about it. You've got to process it, and you've got to do your own research. I just want to throw this in because it's kind of interesting. I homeschool my youngest son, and I use a curriculum. And in that curriculum right now, he, in his social studies class, he's going through following rules. Your rights and responsibilities of being a citizen. And I thought it was really intriguing because it's talking about, well, a good citizen follows the rules. And you think about that as a 6-year-old. Okay. You don't just blindly follow a rule. You think about the rule. You have to understand the consequences of it. Now, if I look at my son and he's going up to the edge of a cliff, I'm going to say, you need to stop, because if you fall off that cliff, you're probably going to get either really seriously injured or you could possibly, die. So I'm giving him the evaluation of what could happen at this point in time. But ultimately, he has the choice on whether he takes a step off of that cliff or not. Will I do my dangest to keep him from falling off? Absolutely. But that doesn't mean that he's not going to make that choice and test that theory. And I think that has been lost in America today, to just blindly follow and say, okay, that's what you say. Okay. No, you've got to think. You've got to think about what's being said and what's going on and what the possible risks and benefits of all these things being presented are.